exactly is infertility, and then do you have a problem or not? So these are very dogmatic approaches to this. This is what the American College of OB/GYN and the American Society of Reproductive Medicine defines as infertility or subfertility. So women who are under the age of 35 typically are given 12 months to conceive. And women who are over the age of 35 are typically given about 6 months to conceive. And then the recommendation is that then you seek some sort of care. Now, it doesn't mean that if you can't be seen or evaluated before this time if you think you have a problem or if there's a natural problem. So I don't want you, or I don't want your physicians or people taking care of you, to be very dogmatic about these numbers. And you should definitely advocate for yourself if you think there's an underlying issue that should prevent either yourself or the people taking care of you from making you wait this long. And so what are those issues that, in the opinion of established medical practice, should prevent you from waiting that long in order to seek an evaluation or care? And so for women, if you have irregular or absent menses, now typically that's defined as menses that are shorter than 21 days or longer than 45 days. If you have negative ovulation kits, if your timing or your basal body temperature isn't rising, any history of a pelvic infection, or a prior history of infertility, those are all reasons why you should not allow anyone to force you into those very rigid and dogmatic treatment algorithms. For men, if there's any medical problems associated with genitalia, for example, a prior mumps infection, any history of trauma, a varicocele, or if there's any abnormal sexual functioning, for example, difficulty obtaining an erection, difficulty with ejaculation, those are all potential signs of low testosterone that will potentially lead to sperm issues, which will delay your time to conception. Now, those times that we've previously discussed are all based on couples who don't have any issues getting pregnant. And so if there are underlying issues, there's absolutely no reason to wait that long, because the statistics are going to be much, much different. And so unfortunately, reproductive problems are increasing in the United States and all over the world. Part of that is people are delaying childbearing, and that causes more difficulty conceiving. Other problems people run into is that treatment is becoming very, very expensive. And there's a paucity of reproductive endocrinologists in the United States and worldwide. So those are all reasons why we've established Fertility Cloud.